The MedStar Georgetown Transplant Institute is one of the leading transplant centers in the United States in terms of volumes and outcomes. In the field of liver transplantation, we are one of the largest centers in the region. So, we are highly experienced and our transplant team is really second to none. All our patients are cared for by a thoroughly qualified, multidisciplinary team that covers absolutely everything you need as an organ donor. Your team will include a hepatologist, a surgeon, a nurse coordinator, a social worker, a donor advocate, and a psychiatrist. Each one is committed to guiding and supporting you through the entire transplant process.
So a living donor gives just a portion of their liver to someone in need of a transplant. The recipient's entire diseased liver is removed and is replaced by a piece from the donor. The liver is the only organ in our bodies that regenerates. The donated organ grows back to nearly full size. The donor's liver also grows back to near full size within about 8 weeks. With over 14,000 people waiting for a liver transplant in the United States, there are not enough deceased donor livers for all the patients waiting for a life-saving organ. Unfortunately, 30% of the people on the waiting list either become too sick to receive a transplant or pass away. So, receiving a liver from a living donor is a real game changer and a wonderful option for some recipients. Whereas a recipient could wait months or years for a deceased donor liver, recipients with a living donor have a much shorter wait time. A shorter wait time means less time for the recipient to become more sick and develop life-threatening complications. So, timing is key. You have to keep in mind that there is a window of opportunity. Once a recipient is eligible for a living donor transplant, they can start sharing their story and the option of receiving a transplant from a living donor from their family members and friends. A donor must voluntarily come forward before the recipient becomes too sick for a living donor transplant. And there are many advantages to receiving a living donor transplant over a deceased donor transplant. Since living donors are healthy people who have undergone extensive medical evaluation, the quality of the liver is likely better. Because the donor's and recipient's surgery happen at the same time, the period of time that the liver is outside the body and without blood supply is a few minutes instead of hours.
There are requirements for the person donating a portion of their liver. The donor goes through a process of evaluation and testing in order to qualify. The donor must have a compatible or identical blood type, be in good physical and mental health, be at least 18 years old and younger than 56 years old, understand the risks and benefits of donation and the alternative treatments available to the recipient, and be willing to donate voluntarily, free of coercion. And it's important to know that there is zero medical cost for the donor. The recipient's insurance pays for all the living donor's medical expenses. Many of the risks involved with donating a liver are the same as with any major surgery. Most liver donors do not experience any complications. The complications that might occur are usually minor. More serious complications include bleeding, blood clots in the legs or lungs, infections, or heart problems. Risks that are more specific to liver surgery are bile leaks or permanent liver failure requiring a liver transplant. And although rare, the mortality rate of living liver donors is about 0.2% or 2 deaths out of 1,000 donors. If you're considering donating a portion of your liver, remember, our #1 priority is your safety. We'll discuss these risks in depth during evaluation. At any point during evaluation, and even up until the day of surgery, the donor may decide not to proceed with donation. This decision will be respected by the living donor team. After surgery, the donor will be in the hospital for 4 to 7 days. This is a major abdominal surgery, so the team will have to work to keep pain levels down, and most donors are pain-free within 3 weeks. You can expect to return to daily activities after 4 weeks and return to work between 6 weeks and 3 months.
The Transplant Institute is committed to guiding and supporting our patients and their loved ones throughout the entire transplant process. As a social worker and donor advocate, my role is to promote your best interests, advocate for your rights, and assist you during the evaluation, surgery, and post-donation follow-up period. I work solely with living donors and coordinate with the transplant team, as we do everything we can to ensure the best possible care for our patients.
Thank you for taking the time to watch this. We feel it's important for you to have the essential information that you need. When liver transplant is necessary, we offer the absolute best procedures and care for both the donor and recipient.